this presentation, we will talk about how to perform venipuncture. Venipuncture is also known as phlebotomy, or the practice of drawing blood for collection and analysis. To facilitate a successful and safe venipuncture, it is important to carefully plan ahead. If at all possible, try to choose a place that's quiet, clean, and that provides privacy to the patient. You also want to be in an area with good lighting. Take note of isolation precautions and wear the appropriate personal protective equipment. The supplies that you will need to perform the procedure are shown on this slide. You will need the proper personal protective equipment, such as gloves, and if necessary, an appropriate mask and gown. Access to hand hygiene supplies is essential immediately before and after the procedure. You will need a tourniquet, alcohol swabs, sterile needles and adapters, syringes, lab tubes, gauze, tape, and a sharps container. You will also need the appropriate laboratory form, specimen labels, and a pen. Lastly, you will need a leak-proof transport bag or container to deliver the specimen for processing. Let's get started with the actual steps in performing a venipuncture. As with any patient interaction, first perform hand hygiene. Put gloves on and wear the recommended personal protective equipment. This is particularly important in order to prevent the transmission of infections or the spread of germs. Provide patient privacy as much as possible. Introduce yourself to the patient. Explain the reason for the procedure and obtain the patient's consent. Always check the patient's identity prior to performing the procedure. This can be done by checking the name and date of birth or the patient's name and medical record number. Check that the test matches the identity of the patient. Things to look out for. Are there any dietary restrictions? For example, is this a test wherein the patient should be fasting? This is particularly important for some tests because it could alter the results. It's also important to check for allergies and any sensitivities such as latex. For patients with latex sensitivities, avoid the use of latex gloves. Some patients can become anxious prior to a lab draw. Put the patient in a position that is comfortable for both of you. If the patient is in a bed, raise or lower the bed to a level that will make it easier for you to perform the procedure. Placing a pillow or towel under the arm can make it more comfortable for the patient. Choose a vein that's a good size, such as the median cubital vein, to increase the chance of success at the first attempt. Apply the tourniquet above the selected site, about 2 to 4 inches or 5 to 10 centimeters. Have the patient make a fist. No vigorous pumping, as this can affect the test results. Disinfect the site with an alcohol swab or with chlorhexidine if drawing blood cultures. Allow the skin to dry completely. Anchor the vein by holding the patient's arm and placing your thumb below the site. Enter the vein at an angle of 30 degrees or less. Using a Vacutainer or tube adapter, fill the laboratory tube until the blood stops flowing into the container. If drawing several tubes, draw in the correct order. This is important to prevent cross-contamination of additives between the tubes. If drawing blood cultures, these should be drawn first. The order of the draw is illustrated in this slide. Release the tourniquet. And withdraw the needle carefully while applying gentle pressure to the site with a piece of gauze. Dispose of the used needle and syringe or blood sampling device in the sharps container. Remember to label the tubes with the patient's first and last name and ID number. Write the date and time as well as your initials. Double check for accuracy. Remove gloves and perform hand hygiene. In children, use the ID band attached to the patient for proper identification. If there is no ID band, confirm the name and date of birth with the parent or guardian. Confirm that the test matches the child's identity. Use a 23 or 25 gauge needle, a small syringe or small volume evacuated tube with adapter to avoid collapse of the vein. Assess the situation and, if appropriate, ask the caregiver if they are willing to assist in holding the child during the procedure. Otherwise, you may need to ask a second person for assistance. Remove as few clothes as possible to keep the child warm, exposing only the limb or site to be used. Warmth will help dilate blood vessels. You can apply a warm pack or cloth to the selected site. To help visualize veins, especially in infants, use a trans-illuminator if available. Venipuncture can be scary to some children. Having a parent comfort their child and participate in the procedure can often be helpful. The parents often know the best way to calm their child. Use age-appropriate techniques, such as distraction in younger children. This is the end of our presentation on how to perform venipuncture, brought to you by the team at Health4TheWorld. We hope you found this information useful.